Hello, Lee Osler here in Cleveland, Ohio. I'm here in my hotel room getting ready to leave this morning to finish the third day of a three-day healthcare symposium at the Cleveland Clinic. I'm looking out the window today at the Cleveland Clinic Learner Research Institute, which is just across the street here from the hotel that we're staying at. This has been a fantastic experience to be here at the Cleveland Clinic with physicians and a few dentists learning about inflammation. It's kind of chilly outside. It's an early day, early fall. The leaves have not started turning, but we do have some cold weather coming on us. But it's really hot here because the subject is about inflammation. Of course, that's kind of the new leading edge or cutting edge aspects in healthcare that we're learning about here. And it's a little bit like a fish out of water experience for me as a dentist to be here at the Cleveland Clinic in a room full of probably a couple hundred physicians and cardiologists learning from the masters about what inflammation is and the inflammatory burden. Today's experience is the third day of the experience. It's the Bale and Doneen reunion here, and so all the Bale Doneen graduates have the opportunity to come to a reunion to get the latest in the very leading edge work in inflammation and preventive cardiology, as well as to learn a little bit about perhaps the oral inflammatory component and how that works. So that's where we're going to be going this morning, as we'll be crossing the street here to the Learner Institute, the Research Institute, and meeting with Bale Doneen as a group. We'll give you a few takes through the morning and the afternoon and let you kind of see what's going on in here. It's a great opportunity for dentists. It's a great opportunity to physicians to learn this cutting-edge science information and to realize how much we need each other in terms of getting people well, especially if they've got vascular disease. So come with me now as we're going to go downstairs and meet with our group, cross the street, and join the Bale Doneen reunion today. We're now crossing the Sky Bridge over into the Learner Institute. One of the neat things about yesterday's presentation, or maybe it was the day before, these days kind of mesh all together with all these esteemed cardiologists and physicians speaking. But we had Dr. Tom Neighbors from Oral DNA who was speaking to us about the implications of Porphyromonas gingivalis and other oral pathogens and their implications into oral inflammation as well as systemic inflammation. And it was really kind of neat to see the reaction of all the other physicians who were listening to this information and were learning perhaps for the first time that periodontal disease matters when you have vascular disease. In fact, many times these physicians are struggling, and they're struggling to find ways to resolve vascular inflammation, vascular disease, preventing heart attacks and strokes and diabetes. And they've done their very best, and they can't come up with any solutions. And it's interesting to find out how many of them are discovering for the first time the implications of periodontal disease in that. So we're going to hear more about that in our meetings today about the implications of periodontal disease. So anyway, we're here in the Learner Research Institute looking for our way. Thank you. So here I am at the Bale Doneen seminar, and I'm meeting with two of my illustrious colleagues, Dr. Dan Sindelar from St. Louis, Missouri.
Hey, how are you?
How are you, Dan? And Dr. Larry Greenblatt in Bellevue, is it?
It's Bellevue.
Bellevue, Washington. So what do you think so far, Larry?
Well, we spent two great days at the Cleveland Heart Lab learning about leading edge information that's going to be coming out in the next year or two. It's going to probably advance our thinking and how to take care of our patients even further and prevent those heart and stroke attacks. And
What
pretty
impressed
exciting.
you the most?
Probably a couple talks. Mark Penn was pretty amazing in terms of what's going to be on the docket for us to look at HDL and dysfunctional HDL. I was totally impressed with what the Cleveland Clinic has done. Dr. Rosen has performed in turning this place around in terms of nutrition, wellness. Was it 18,000 smokers have quit or something like that? Unbelievable. So it's a pretty powerful place that we're sitting at, and looking forward to the reunion with Brad and Amy and see what's new on their docket for us to take back to our patients.
Yeah, thank you. Let's ask Dan. So Dan, what's going on in your life here at Cleveland?
Well, thank you, Lee. It's very exciting to be here. We're here at the Cleveland Clinic and participating in the Heart Symposium, and to see the alignment of physicians and dentists is very exciting for me. And also, as you know, this is a passion of ours with AOSH, and leaders of the medical profession like Larry just have helped us so much in figuring out our part and how we can assist them in their care. It's very powerful, and like you say, the wellness, this whole center, and to see their approach to wellness and how heart attacks and strokes can be prevented, and the systems that can be implemented, it's very exciting.
Yeah, I'm here with Brad Bale, and he's going to give us a little interview.
Yeah.
Hi, Dr. Bell. How are you doing?
Doing great, thanks, Lee.
You were talking to us a little bit about the implications of dentistry and some of the medical parameters and how we could screen for heart disease in a dental office. Could you comment on that?
Yeah, well, first of all, we know that a condition we call insulin resistance, which leads to type 2 diabetes, but long before that, it's going to damage the arteries. So insulin resistance is the biggest cause of arterial damage. So being able to diagnose that in a patient before they're diabetic is extremely valuable. And anytime you identify insulin resistance, that patient deserves a very thorough cardiovascular workup. There was a study published recently that tells us how the dentist, in a very simple way, can identify these individuals. And that is if they have 4 or more missing teeth, or they have 26% or more pocket depths of 5 millimeters or greater, coupled with the A1C, hemoglobin A1C measurement of 5.7 or higher, with 92% confidence, they can look at that patient and say, you have insulin resistance, you're headed for diabetes, but more importantly, you're damaging your arteries. You deserve the benefit of seeing an individual who can perform a thorough cardiovascular assessment. We would argue, certainly all the people that have been through our 2-day course, the Bale Doneen method course, would be medical providers who could provide that type of assessment. So this is a good way the two fields can interact together. It's very simple. It's easy to do the A1C. The patient doesn't have to fast. The dentist could do it in his office easily. It's simply a finger prick. Doesn't cost much. If that's 5.7 or higher, and the patient has 4 missing teeth or more, and or 26% of their pockets are 5 millimeters or greater, 92% chance that patient's insulin resistant. They need to be referred on for a thorough cardiovascular assessment. A wonderful way the two fields can interact, and again clearly illustrates the oral systemic connection with all this cardiovascular disease and diabetes.
Thank you, Dr. Bell.
Okay.
So we're here at the Cleveland Learner Research Institute. We're going to go in now with Brad Bell and Amy Doneen.
Thank you.
Hi, this is Lee Osler reporting in after 3 days of having my brain fried at the Cleveland Clinic at the annual symposium on where inflammations meet lipids. It's been a great experience. The third day was a Bale Doneen reunion for graduates of the Bale Doneen program. And boy, I tell you what, the world-class cardiologists, physicians, a number of different specialists were included here. There were some dentists, nephrologists, urologists, primary care physicians, cardiologists, quite a broad assortment. And of course, some world-class research scientists. Mark Penn, Tom Neighbors was also here representing oral DNA. He spoke at the Cleveland Heart Lab Inflammation Symposium. We also heard from Dr. Jeff Life, MD, who you may have seen on some airline magazines, speaking on the issues of cardiovascular disease, endothelial dysfunction, and men's sexual health. So it was quite a fascinating presentation and a wide variety of presenters who were here. So I guarantee if you want your brain fried, this is a good place to be, and I hope that you'll take advantage of it the next time it comes around. As many of you know, I've been working in the arena of physician and dentist multidisciplinary or interdisciplinary referrals and developing treatment protocols that will cross-refer and help. And I've always been intrigued by the concept that you've got to play in their playground, and that's basically why I came here, was because I realized if I'm going to be good at this, I've got to play in their playground and I've got to know what's going on. I can't tell you the number of physicians, I lost count of the number of cardiologists and physicians who approached me and had very serious questions about how do they know when they have a patient that has vascular disease and they're working really hard to treat them. How do they know they can trust the dentist that they refer them to, that they'll do the right test? In fact, I was meeting with one dentist, had dinner with him on the cruise, out on the dinner cruise out on Lake Erie last night, and he was asking questions about gum disease. How does a dentist tell if there's inflammation? I described perioprobing and bleeding and pockets and so forth, and he was clueless. He didn't know what that meant. I asked him if he'd ever had his dentist probe him and count the numbers and talk to him about bleeding or any of those kinds of things. He said he'd never had that happen, and then he looked at me and said, maybe I need a new dentist. I said perhaps, but the point is these physicians who are becoming increasingly aware of what we dentists do and understand the implications of the oral inflammatory burden, they're becoming aware that they need to partner with dentists who get it, who understand that the standard of care may not be adequate, that they need to be doing bacterial testing, and the clinical signs and symptoms of periodontal disease that we've classically used really aren't the cutting edge anymore, that there's metabolic profiles and bacterial DNA testing and many lifestyle factors that blend into this, and that the oral inflammatory burden is really a part of cardiovascular disease and endothelial dysfunction. Likewise, there's a growing number of dentists that are learning that they need to partner with physicians and cardiologists who also in their respective area get it, so that when we refer a patient to a physician, that we can trust that they're not going to be told that everything's okay. There's a big difference between waiting for the event, waiting for the manifestation of disease before you start doing profiling and treatment, that you can way ahead of the game, you can begin treating these things. One of the fascinating things that came out of the discussion yesterday in the Inflammation Meets Lipids Heart Lab conference was there was a presentation, admittedly perhaps a bit theoretical at this point, but you can kind of see where this is going, where analysis of advanced lipids testing can allow you to see diabetes and insulin resistance coming 10-15 years before any other conventional methodology would do. So there's some exciting things happening in the world of cardiovascular disease, endothelial function or dysfunction, and of course the oral inflammatory burden. A full 45 minutes was spent in the presentation by Dr. Tom Neighbors, who was invited to speak, discussing the oral systemic connection and the implication of oral pathogens and their effect on endothelial function. The connections with LP plaque 2, the connections of oxidized LDL and how macrophages interact with that, and the role that oral inflammation plays in that. Very, very fascinating stuff. So anyway, I'm just enjoying my time here at the Cleveland Clinic. I wanted to give you all a sneak peek at this and maybe a few cuts from a couple of conversations I've had with some of the key people here. I invite you all to consider next year coming to the Cleveland Clinic and participating in the Cleveland Heart Lab Symposium, as well as to take advantage of all the American Academy for Oral Systemic Health meetings that are coming up. We're trying to do some regional meetings, as well as obviously next year in June, the annual meeting. Be some great stuff happening. I hope you stay tuned. And this is Lee Osler, and out for now.